Hi everyone, I hope you all are doing really well. So today let's learn about breastfeeding. It also says that breastfeeding is the nature's perfect start for both mother and the baby. So let's start. First, understanding breastfeeding. What is breastfeeding? Okay, so it is the process by which an infant receives its nutrition directly from the mother's breast, which includes both physical act of nursing and transfer of a breast milk, which contains nutrients, antibodies, and bioactive compound. So why it matters, what is the importance? Okay, so first is it provides an optimal nutrition tailored to infant needs. Number two, it helps in building immunity. And then number three, it promotes mother and child bonding. So now let's see what is exclusive breastfeeding. And exclusive breastfeeding is a feeding the baby with only the mother's milk for up to 6 months. During this phase, not even a water is given. Okay, so breastfeeding it should be extended up till 2 years or beyond. So now benefits of breastfeeding. First, let's see in infants what are the benefits. First is it reduces risks of infection, especially otitis media, respiratory and GI tract infection, which is very common in newborn or and infants. Number two, long-term protection, such as reduction in obesity and diabetes later in life and certain childhood cancer. Number three, it is cognitive development, where it is found that the breastfeed babies have a much higher IQ. And then number four is customized nutrition. As the baby grows, the milk composition changes to meet new infants' developing needs. And number five is very important. 50, it has been shown that 50% reduction in SID, which is sudden infant death syndrome in babies. It reduces sudden infant death syndrome. So now let's see benefits for mother. First is recovery phase. Soon after the delivery, as we all know, oxytocin gets released. So oxytocin does is it helps in uterine contraction. So that in turn helps in reducing postpartum bleeding. Number two, it reduces cancer risks, especially breast cancer. And number three is metabolic health. It helps in lowering the risks of type 2 diabetes. And number four is contraceptives. Yes, it acts as a contraceptives as well, which also is called as lactational amenorrhea. If the mother properly meets the criteria of all the criteria of the LAM, which is lactational amenorrhea, she is protected for up till 6 months. And number five is mental health. Yes, and it is shown that uh, there is a reduction of postpartum depression if the mother breastfeeds. Okay, so now let's move on to position and technique for breastfeeding. So before we learn about the position and technique, there are two things that we need to remember. First is the mother should be in the comfortable position. This is very important. Number two, another very important thing is the mother should be stress free while she's feeding her baby. Okay, so first let's learn one by one. First is the cradle hold, where this is a conventional method of breastfeeding, where the baby's body and the mother's face will be facing each other, and mother will be holding the baby under her arm. So this is usually common for term babies or a baby who has a good head control. Okay, so number two is the laid back hold, or here what it is like the mother will be in a lying position, or can be sit in a follows position. And here what happens is like the baby will be sitting on the mother's abdomen and will be facing towards the mother's breast. Okay, and this is very this position is helpful for those babies who with reflux or ear infection. Now, number three is the football hold. Here the baby is stuck under mother's arm, like how we hold the a football. So this is ideal for those mothers who have undergone cesarean section, uh, uh, or for the mother who has a large breast, or mother with twins babies. Okay. Now number 4 is the side lining position, where the mother and the baby will be lying down together in the lateral position. Okay. Along with all this position, there are certain things, certain techniques that you need to assess, which is the latching. Mm, Make sure that the while the mother is feeding, the mouth of the baby is widely open, the lips are flanked out, chins are touching the breast, and nose is free. Okay. So while the baby is being breastfed, the mother should not feel any pain. Okay. So let's Okay, so now let's learn about the importance of night feeding. This component is actually very important in breastfeeding, but unfortunately, it is least discussed, or least counseled to the parents. The reason as to why it is important is because of this hormone, prolactin hormone. Prolactin hormone is something that it releases only at night. So and prolactin is the hormone that helps in milk production. So that is the reason as to why the mother has to breastfeed during night time also. And the second thing is the night feeding maintains adequate milk supply and prevents engorgement. Engorgement is the most problem that the mother faces. uh, and why is it important, or benefits for the infants? Infants actually receives 20 to 30% of their daily calorie during night feed. And the other benefits is breast milk at night contains melatonin and tryptophan that helps establish circadian rhythms. This is very important. And the other thing which is very important that we need to tell the mother, that is that night feedings are biological norm, not a failure or a problem to be solved. Okay. Okay, so let's discuss about the disadvantage of artificial feeding. The first problem or a concern with bottle feedings are number one is physiological impact, that is nipple confusion or preferences. Now here what happens is, like, when the baby gets both the breast and the bottle early, they get bit mixed up because sucking from each feels different. This makes breastfeeding harder for them, and harder for them until they get adjusted. Okay. The other number two is the with the number two is the bacterial contamination. So here what happens is, when the bottle and the nipples and the formula are not cleaned properly. Okay. Because in a day the baby has to be fed at least 8 times. Okay. So and each time the bottle has to be washed, and it should not only be washed with the soap and water, but also has to be boiled each time, so that the bottle is clean. Okay. So but then here, if you leave the bottle, if you leave the bottle with the formula in, or the bottle is not been cleaned properly, the chances that the baby gets infection, the chances, or there is a risk of GI infection. Okay. So number 3 is the flow rate. If it is too fast, then it can lead to choking, or and then aspiration, right? Choking and aspiration. And if it is too slow, it can be frustrating. So number 4 is the bonding differences. Less skin to skin contact, because there is no skin to skin contact. And yes, it can be the bottle feeding can be done by anyone. So the other problem, so now let's learn about the top feeding concern. Okay. The first one is the nutrition concern. So there is the potential for inappropriate dilution and concentration. Number 2, economic burden. um, we all know formula feeding is very expensive. And long term health, there is a higher rate of asthma, allergy, and metabolic disorder later in life. And supply interference. um, yes, if a mother is not regular with her feeding, as what happens is like there is a reduction in breast milk production. Okay, so yes, again, for the mothers, those mothers who are not able to breastfeed, we need to support their choice and provide an evidence-based guidance on safe formula preparation and feeding practices. Okay. Okay, so now let's discuss about the maternal nutrition, one of the most important component in breastfeeding. The daily requirement for the mother is, if it is calorie, then additionally 330 to 400 calories above pre-pregnancy is required. Okay, if it is protein, then 71 gram daily. Calcium, it has to be 1 gram daily, which is 1000 mg daily. Okay, and water, it is minimum of 2 to 3 liters daily, and if it is in the hot weather, the mother should drink more. The other thing that the mother should consider is taking iron and calcium supplement for another 6 months post delivery. Okay, so now let's learn about the common problems with breastfeeding. The first one is the mother complains about the dry nipple. As a nurse, you need to inspect for any crack, fissures, or bleeding. So if you find any of these, educate the mother on correct latching. And after that, the mother can also apply the express breast milk on her nipple, especially the hind milk. And then she can also apply hydrogel pad or lenonin cream, or if she's on in pain, pain medication. Okay. The other problem is the breast engorgement. Check for any firm or breast tenderness. Possibly she might be having a flattened nipples as well. So here what you need to do is like ask the mother to feed her baby, and also educate her on reverse pressure softening. This is when the breast feel too full and firm, especially around the nipple. Ask the mother to use her finger to gently press around the nipple for a minute or two. So what happens here, this moves the swelling back and make the nipple softer. Here uh, that is when the baby can be latched and it feels better. Okay. And then again, the other thing is like she can use cold compression, which is mother can use cabbage leaves. Number three, the most problem is the mastitis, where you can the mother comes with a complaint of fever, and there is a localized breast inflammation. Okay, so here also it is the same thing, that you need to ask the mother to continue breastfeeding, and if it indicated, antibiotic should be given, and along with that analgesic, and ask the mother to increase her fluid intake. Lastly, the nurse's role in breastfeeding support. First is the assessment. You need to do an assessment, which is to evaluate the mother's knowledge on breastfeeding, her belief on breastfeeding, certain belief she might be having, support system, which is her family, her environment, and physical readiness, whether she is prepared or not, and also perform a comprehensive breast assessment to rule out any breast related problems, and also do document her previous experience on breastfeeding. So number two is to provide a conducive environment where breastfeeding is normalized. Okay, and where it is given importance. Also given emotional encouragement to the mother, especially to primary mother who is feeding her baby for the first time. So at that time, maybe there are very high chances where the primary mother might get emotional when she's not able to feed her baby. So here you need to give an emotional support. Number three is to education. Provide an evidence-based information on all the breastfeeding components, such as like technique, hunger clues, expected feeding patterns, and any common troubleshooting any common problems. Okay, and demonstrate the position and latching also. And number four is the continuity of care. Connect the mother with the lactation consultant. Here every hospital has a lactation consultant. You have to connect the mother to the lactation consultant. She or he will be supporting on breastfeeding. Okay, any breastfeeding related problems or any doubt she has, the lactation consultant will be helping her out. Okay. O- okay, thank you so much. If you like the video, please do share with your friends and like and subscribe to the channel.